Good morning and welcome to Mental Health Matters. It's the show where we take a deep dive into all things mental health and well-being with me, Dr. Audrey Tang. Today our topic is chronic pain and fibromyalgia, and we've got Amy Lawrence joining us today to tell us about her journey as well as how she's become a practitioner and an advocate for those suffering with chronic pain. Let's head over to the main studio. So, welcome to Mental Health Matters, Amy.
Hello, thank you for having me. I'm really excited to be here.
I'm really grateful you could come in because this is a topic we haven't actually covered fully, but I think we need to cover because when it comes to chronic pain, it's a bit like mental ill health. People can't see it, and so they can't tell how much you're struggling, and so that's why I'm so grateful to you for coming on the show. Would you mind sharing your story and your journey as to how you came to be the practitioner that you are?
Yeah, absolutely. So I started struggling with chronic pain around 6 years ago now, and there was a lot of sort of chronic stress in my life at the time, a lot of illness and things like that that I believe has sort of triggered the chronic pain, and it was just a real challenging time in my life. The pain was so debilitating. I kept going to and from doctors to try and get answers for what I was going through, and it took me actually 4 years to get an official diagnosis of fibromyalgia.
4 years?
Yeah, so for 4 years I didn't really know or truly understand what was going on with my body. So that's a very long time to be struggling with pain that you've got no answers for and you've got no relief from on a day-to-day basis. So what made me become a practitioner and coach was the fact that I felt so alone on my own journey and just so misunderstood, and I didn't really feel like I got the support that I really needed. So when I started to eventually feel that little bit better, I was like, I've got to help other people with this. I just have to be that kind of support for other people, because I just couldn't stand the thought of other people going through what I was going through and feeling as alone as I was at the time.
That's really awful. I mean, do you mind describing, if you can, I know it's kind of difficult and it's so individual to everybody, what sort of symptoms you were experiencing?
So this was widespread body pain, so everywhere, every bit of my body ached or felt like it. The way that I describe it to people, because obviously chronic pain is often invisible, is that my worst days of fibromyalgia, I felt like my body was being stabbed with knives. Now, I've never been stabbed with a knife, but that's the only way that I can describe it. Sitting on a chair was hard. I just couldn't sit still because I just felt like I needed to constantly try and find a position where I was comfortable.
Oh, gosh.
And yeah, that's sort of the extreme side to how debilitating it really was. I couldn't concentrate on anything because all I was thinking about was the pain. So yeah, it was just absolutely horrendous.
And I mean, this relates very much to, you say it, invisible illness, it's mental ill health as well. You've got people who are really struggling, like yourself, and it's so exhausting trying to find a place that's comfortable, trying to find some relief. And it's the same thing with negative automatic thoughts. You're just fighting your own mind the whole time. Why do you think it's still so misunderstood? Because we know people experience mental ill health. We know people suffer from fibromyalgia. Why are we still going, oh, you'll be fine, you'll get over it, which is horrendous?
I think a few things play a part in that, and I think the invisibility of the symptoms is a huge thing. But not only that, the fact that other people can't see what you're experiencing, it's also the testing that you go through. There's no official testing in terms of, like a blood test or anything like that for fibromyalgia. So you actually go through a process of elimination of everything else first, and that obviously is where the time thing comes in, because you're on another waiting list for another referral. So you're just constantly in this waiting game, and it can be exhausting within itself, on top of already feeling exhausted from the symptoms that you're experiencing.
And so demoralising as well, isn't it, when you can't find answers. I mean, in your own experiences, and I really like your Instagram page. I think you put some very short, sharp thinking points on there. And one of them that really jumped out at me was medical gaslighting. The fact that the medical profession can dismiss us and effectively gaslight us into, thinking, oh, it must be in my head, I must be making it up. And then the worst part is we start gaslighting ourselves. We start going, oh, it's not so bad. I mean, how can we get people to get it?
I think by listening to what patients are telling you, and I'm just going from a perspective of, rocking up to the GP and feeling like they're not listening or being dismissed altogether. You just often go home thinking, well, shouldn't have bothered with that appointment. Why did I reach out for help? Why did I reach out for support? And I think that's why those with invisible conditions like fibromyalgia often do get to a point where, oh, actually, I've just got to get used to it now. I've just got to get used to it how it is, because often you feel like you're not taken seriously. And I think it's so important to talk about this because it has such negative impacts on those that are suffering further than they already are.
Yes, exactly. You've almost put a barrier up. And relating to that, I understand that watch and wait is a clinical term, and I get that because you don't necessarily want to have a strong intervention if maybe it will go away. I'm not talking about fibromyalgia, I'm talking about any other disorder. But what sort of things have you experienced, just so we can look out for it, just so we know? When you leave the doctor, you kind of think, was that? But we don't know. Yeah,
so examples of medical gaslighting can be things like being told that you're too young to have that. That's a big thing within, those that are young, especially in my experience, women, being told, oh, well, you're too young to have that. That's something you get when you're older.
That's ignorance, isn't it? That's not even...
Yeah, age doesn't even come into it. You can be any age and struggle with a chronic illness or an invisible illness. Other examples can be, not only just fibromyalgia, so chronic pain in general with women's health conditions, oh, you're just having a bad period. Yeah. Oh, brilliant. I've never had a very good one, to be honest. That's gaslighting.
Yes,
it's not helpful, and it's really, really disregarding and dismissive to what the person that's going in with these very real medical concerns is experiencing. If you're out of work for 2 days of the month because of your period, that's not normal.
No.
And that has such a big impact on your overall quality of life,
And the thing is, with someone like you, you've built up the confidence to be able to speak and ask for a second opinion, for example. But given that young women in particular will be presenting with symptoms, if we don't have the confidence to say, are you sure? And it took me a long time to ask about things like perimenopause and menopause, and I'm much older. And how might you suggest we can push a little bit more to get answers, or at least get taken seriously?
I think if you're going to the same doctor, just challenging it a little bit, and I know that can be challenging within itself when they're almost the authority of the appointment, and you go to them for the help and support. But if they can't see your symptoms, often they don't really have a really good understanding of how much that's impacting you. So challenging them can be helpful, not in an awful way, but just being like, I understand that my test results have come back fine, but this is something that's really, really impacting me on a daily basis, and really trying to get them to comprehend just how much things are really impacting you.
And actually the point that you make about there's no real test for fibromyalgia, that's probably worth recognising as well, isn't it? And being able to sort of tell people, but we know there's no test for it, therefore if things come back fine or clear, does it necessarily mean we can rule it out? I think that's a really key point that you made. And in terms of people recognising this, so doctors maybe finally get thinking, okay, right, we do need to do something. They send you for one test, and then that's it. And then they go, oh, not just challenging. What else? Can we seek a second opinion? What might you suggest?
Definitely. If you're not happy with the doctor that you're seeing, or you feel like you're not getting the support and the care that you really need, I'd go and get a second opinion. Finding the right doctor is really important. And I often say, actually, I mentioned it on my podcast on one of my episodes, I think I went through the whole doctor surgery at one point. I just felt like I wasn't being heard.
Oh, gosh.
But I've got that, strong mind, and I was like, I'm not backing down, I'm going to be heard eventually. I mean, it did get to the point where I actually went private with my symptoms because I just wasn't getting anywhere.
Oh, gosh.
And I always go back to that 4-year, like, not even a wait. It was like 4 years of exhaustion and
4 years of pain.
Yeah, pain. Yeah, to try and feel listened to, and mentally, honestly, that just completely broke me. On top of obviously the pain that I was going through, and then feeling like nobody understood my pain or could see my pain, but I was in my body and I knew that my pain was real, and it's so important for people to listen. So yeah, my advice would be to, if you're not happy, find another doctor and make sure that you keep pushing until you are heard. I know it's wrong that you have to do that, but it's really important that you do.
I fully back that up. And Amy's going to be staying with us, and we'll be back just after this.
Hi, this is Clara Capano, your host for Women Winning Their Way, where we talk about how you can create success all on your terms. Join us Thursdays at 8 p.m. Eastern Standard Time on the Limelight Network here on E360 TV.
Welcome back to Mental Health Matters. We've got Amy Lawrence here. She is a coach. She supports people with chronic pain. She's been sharing her own story and journey with fibromyalgia as well. And Amy, you host Pain into Power. Pain into Power. What are the common themes in the field that you've recognised that are not being addressed?
I think mental health is one of them, to be honest. I think the emotional toll it can take on your mind, not just the physical aspect of the pain, is something that I think is just not spoken enough about, really. And how much of a fight it can really be when you have this chronic pain. You start to notice that the symptoms are ongoing and they're persistent. I think it's more than 3 months of ongoing symptoms they class as chronic pain. And I think just that emotional toll that can take on your mind. You just feel like you're in a constant fight with your body at times and trying to push through another day, and you often do end up having that warrior mindset with chronic pain, because you almost feel like you don't have any other choice but to start to get through another day and fight it. So yeah, the mental health side of things, I think, is not spoken enough about.
And I love Pain into Power. You're talking about really claiming that, I guess it's claiming your power back over everybody who's telling you what to think and telling you how you're feeling. How can we help friends and employers even to be more empathetic, to ask? I know listening and I know speaking about it, that's really important. I almost feel like, if they actually experienced it, that would be great. But how might you suggest we can get them to really try and get it?
I think just listening to understand and not give too much advice can be really, really helpful, because often those with a chronic illness like fibromyalgia, for example, just need to be heard. They just need to be listened to. And, often there can be really, really bad days, and you just need to be heard. You just need to be understood. And I think when it comes to family, which, I've got my own experience of feeling so frustrated with family because I look fine, can be really, really challenging. So I just think trying to look beyond the surface a little bit and just trying to understand how pain might affect someone every day, or how the fatigue can affect you every day, because that's not the same as just a general tiredness after a working day. It's just a complete exhaustion at times. So I think listening to understand can be really, really helpful, and just trying to support with the little things throughout the day can take off so much pressure from someone who's struggling. There's something called the spoon theory, where you sort of wake up in the morning with a certain number of spoons. And the thing is, with energy, with a chronic illness like fibromyalgia, we have to manage it differently, because we do only have a limited number of spoons throughout the day. So yeah, just helping in terms of taking that bit of pressure off, whether it's doing something throughout the house, throughout the day, just taking the load off a little bit can be really, really helpful.
I like the spoon theory. It's because I think it's a really nice visual. You sort of start off with about 5 spoons, and then sort of through the day, these spoons get depleted. But I mean, if we're talking about just looking at our battery on a phone, is that wears out during the day, it will just go off. And we need to be aware of that. And that's even more the case when you're struggling with something that's going on inside as well. Now, you mentioned the fatigue. And I know that fibromyalgia is sometimes confused with chronic fatigue syndrome. Do you mind unpacking that a little bit for our viewers?
Yeah,
please?
so I think it's confused with chronic fatigue syndrome because the symptoms can be so similar. And again, with chronic fatigue syndrome, there's not often an official diagnostic test that will confirm that you have it. It does go through, again, a process of elimination and based on your symptoms. But chronic fatigue syndrome is classed as a neurological disease with different symptoms, and I think the confusion comes from the similarities of the symptoms, to be honest. You know, you can get headaches with chronic fatigue syndrome, but you can also get headaches with fibromyalgia. You can get pain, some pain with chronic fatigue syndrome. Then you've also got the pain of fibro as well. So it's just an overlapping of symptoms, I think, that can make it really, really challenging. But then also, there's those with fibro who also have chronic fatigue syndrome as well.
Yeah,
so it's easy to get them confused, but fibromyalgia is associated with the chronic pain as well, widespread chronic pain.
And that is important to distinguish, because whilst you say, yes, some people may have both, if you're misdiagnosed with one over the other, you're not going to get the support you need. And,
Definitely.
Oh, gosh.
Yeah, and that's where it becomes so tricky, because if you get that misdiagnosis, you're not getting the appropriate health care and support that you do need to be able to manage your symptoms.
Absolutely. And you started talking about some of those symptoms, like headaches and so on. What sort of symptoms, especially when they've just been a little bit ongoing, should precipitate a trip to the GP?
So I think if you're constantly feeling like flu-like, so, you know, you're waking up in the morning and you feel like you're dragging your body around. It's been ongoing for, 3+ months.
Yeah.
And I think when you get fibromyalgia symptoms, you also almost start to have a sense that something's not quite right. Just within yourself, you might still try and push yourself in the gym, for example, and you might find that you're not recovering very well. And the pain, I just think for me, just going back to my own personal experience, I just knew something wasn't right because the pain was just so different to your general sort of aches and pains that you'd get, Some people just get general aches and pains, but this was so different because the pain would differentiate in sort of sensations as well. So it'd go from sharp to like annoying pain to an ache and just generally feeling quite unwell within my body.
Yeah. Do you think in this day and age we're kind of good at just saying, I'll just take a paracetamol or whatever drug to get rid of it and I'll carry on? Do you think we listen to our bodies enough?
No.
What can we do? I think you're right.
I think the world's just so busy, isn't it? Yes. And you just keep going and going and going. And I think within my own experience of getting fibro, that was my thing that made me think, I just can't keep going. I can't keep living like this because I just felt completely exhausted all of the time. So I think, bringing in that self-care every day, especially, with chronic illness, is so important. And I think often that just leads me to like feeling like you're not doing enough or feeling like you're being lazy, and that's how the world can almost make you feel when you're not doing as much or being as busy as maybe you were previously.
Yeah. And then with the medical profession not even always recognising it, you're almost fighting two sides, and that's tiring enough as well. Oh my goodness. Okay, what about flare-ups? How do you manage those flare-ups? Because even if you're getting the support you need, there will be times chronic stress can bring them on, that it just gets really unbearable.
Yeah, definitely. So with flare-ups, with fibromyalgia, finding your own triggers can be really, really helpful. Stress can be one of them, unfortunately. So bringing in stress management techniques and really learning to manage your stress a lot better can be really, really helpful. In terms of flare-ups, the overdoing can really, really trigger flare-ups as well. So getting to know your own limits, which can be so tricky when you want to keep going and you want to keep going and doing as much as you previously could before getting chronic pain. That's where the challenge comes in, because you keep trying to do as much as you could before. So it's getting to know your own limits and your own baseline with where you currently are on your journey. And I do believe that flare-ups can be brought down to a minimum. I do believe that by, doing a lot of the pain management intervention stuff, flare-ups can become less of an existence in your life. And I can't believe I'm here saying that 6 years later, because I felt like I was constantly in one every single day. It just wouldn't go away. So yeah, it's just having that hope that actually it can get better. If I heard that 6 years ago, I'd be like, oh, just a sigh of relief. Because, just knowing that, okay, this is how it is at the moment, but actually it can improve.
But it takes work, doesn't it?
It does.
Takes maybe a change of mindset where you have to start listening to yourself a lot more and recognising. I like your point about the limits. I know it's something that we haven't necessarily, I haven't put into the thing to go into, but I did want to ask you, how do you support a woman in particular who used to be able to do all of, go to the gym, hold down 2 jobs, that kind of thing, and that's the mindset, and now physically she can't do it? How do you help her change that mindset?
I think this is where the process of acceptance can really come in, and it's such a process is what I'm trying to say, because I think there can be this expectation almost you're going to wake up one day and be like, right, I accept this now, this is how it is. And in reality, that's not necessarily true. And you do go through a process of grieving with a chronic illness, because you do grieve the body that you had, or, being able to do things without a second thought, or without, having to plan in advance and do all of this stuff. So I think, acceptance is just so important on a journey like this.
That grieving process is really important. We're going to keep you with us, Amy, and we'll be back just after this.
A world without the arts is one without confidence, creativity and community, and yet funding has been reduced every year. Arts programmes have been shown to benefit social inclusion and well-being, particularly for marginalised groups, with projects fostering a sense of belonging, cultivating mutual understanding, and breaking down social barriers and isolation. Participation in arts programmes can help boost confidence and open doors to opportunities that may otherwise be inaccessible. Click Arts Foundation offers grants up to £2,000 for grassroots arts projects twice a year, with our community arts experience trustees meticulously scoring each project on impact and sustainability. To date, we have supported craft and visual arts projects, dance, drumming for well-being, and preservation of heritage and culture. If you share our passion, not just for maintaining the arts themselves, but contributing to the many benefits it can bring, please consider making a donation to Click Arts Foundation registered charity.
Welcome back to Mental Health Matters. We've got Amy Lawrence here with us. She is a coach and an advocate for people with fibromyalgia or who are experiencing chronic pain. And we've been talking a lot about flare-ups, about getting the medical profession to recognise what chronic pain is like. Do you mind sharing with us what a day can look like when you have fibromyalgia?
Yeah, so I think, again, this is different for everyone, depending on where they are on their own journey or how they respond to having a condition like fibromyalgia. Some people do continue to work. Some people choose not to work anymore because their symptoms are so impactful on their everyday life. I do think in terms of the management of fibromyalgia and how the day looks involves a lot of, pacing yourself, and might involve a lot of breaks throughout the day, maybe even a nap in the day because you're so tired. But again, it's very individual to the person, really, and everyone's different. I think that's so important to mention.
It's about finding how you can best manage, and then once you know that, it is almost easier to be able to tell other people that and almost build that into whatever it is you're doing.
Yeah.
But it is about recognising what our body needs. That's important. Something else though, and we've been talking about symptoms and diagnoses and so on, but what I love you put on your socials recently is you remind people, I'm a friend, I'm a daughter, I'm a sister, I'm an aunt, all of those things. Why is it so important that, yes, we've got to accept a diagnosis, but that doesn't mean our diagnosis defines us? Why is it so important to remember who we are?
So important, so important, because when you do start struggling with a chronic illness like fibromyalgia, it does start to consume your life, you know, especially when symptoms aren't very well managed. And I remember my life, I'm just thinking, you know, my own personal journey here, it did take over for the first couple of years because I couldn't do anything. I felt like I couldn't leave the house. I was very much housebound. Gosh. And I think part of the process to acceptance actually is bringing in things that you enjoy again, finding new things that you enjoy, because it might completely change to what it was before.
Of course.
And this is where you can widen your identity a little bit by, you know, bringing these other things in.
I love that.
Because otherwise, you know, you do feel a bit stuck. And like, I remember at times just feeling stuck in a body full of pain, and I was like, this is my life, and I felt like my world just shrunk to, you know, so small. And I remember waking up one day, I actually booked myself, I was scrolling on Facebook, booked myself a photo shoot, and I was like, you know what, I feel rubbish. I was literally like, I feel rubbish. You know those boudoir shoots?
I know those.
To do one of those. I was like, I feel like crap, but I'm going to go do it anyway.
Yes.
And it was all about boosting confidence and stuff. And it was that moment where I was like, I did that, you know, afterwards I was a little bit sore because they get you to do all these poses and stuff. But actually it gave me evidence that I can do stuff. I might have been in a bit of pain afterwards, but actually I can widen my life up a little bit and bring things in again that I do enjoy. And I never thought it would be a photo shoot like that, but, you know, it was something different, and it did open my world up a bit from that point forwards.
I think that just is, we need to hold on to that for a moment because it's so inspiring and so important, because you're absolutely right. Whenever we might get a diagnosis that affects who we were, and yes, we talk a lot about the grieving process. We seem to know about that bit. But it is about feeling, yes, your world gets quite small, but you need to broaden it again with different things.
Yeah.
And actually, whilst we say, oh, that's not me, I don't think we would have ever had the chance to know whether it was us or not had we not been in a position where we had to reach out and try something.
Yeah,
so
definitely.
That's so inspiring. I love that. I love that. And with the acceptance, so let's come back to that, almost that fine balance of acceptance, growing with where we are now with the new reality. Why is that balance so hard to strike? Why do we sit there and go, but I was always...
Yeah, so I think striking that balance between, you know, overdoing and underdoing with fibromyalgia can be so tricky to navigate. And to be honest, this is partly why I wanted to become a practitioner and coach, to help people feel supported and guided on that journey, because I know how difficult it can really be.
Yes.
And that doesn't mean to say that you won't overdo things from time to time, because you will. None of us are perfect, you know. There might be times where you do have more on one week, and, you know, you might have to have a bit more rest the week after. But that's okay as well, and it's just allowing yourself permission to, you know, have more rest when you've exerted yourself a lot more. But yeah, that difficulty of finding that balance can be really, really challenging. And I just think giving yourself some grace, giving yourself so much compassion. I always, you know, talk to my clients about compassion all the time because it's such a game changer with chronic pain anyway. Just allowing yourself patience as well, and just remember that you're on a journey, and, you know, you're not going to get there overnight, but you can get to a much more balanced place.
Oh, compassion is so important. And it's not just what we say to ourselves, it's how we treat ourselves. It's the whole thing, and it's almost changing a belief system, because I think a lot of us are really hypercritical of ourselves, which probably then explains why there's so much hypercriticism that we push out there as well. Yeah. So I think, that's definitely really, really important. Now, you also talk about painsomnia, which just encapsulates what it can be. When you struggle to sleep, so insomnia, you're just tossing and turning. When it's due to pain, you can't even get comfortable. It's not even, I mean, how do you manage that?
It's such a challenging thing, painsomnia, because when your pain is out of control, you almost feel like there's no sleep in sight. And when that goes into another day and another day and another day, and it's why I'm so passionate about the sleep side of things when I'm working with my clients, because if we can improve sleep, so much more improves within your life. Your mood improves.
Yeah, 100%.
Your pain will improve if your sleep's better. Your fatigue will improve if your sleep's better. But painsomnia, you know, trying to get comfortable when you are not comfortable to sleep is really, really challenging. So there's loads of different things and loads of different tips that I can suggest.
Amazing,
for
yeah.
pain
Just give us your
insomnia.
top three, maybe. Or
Top three, okay. So thinking about your sort of sleeping position. So, you know, I've got one of those U-shaped pillows. Just little things that you can bring in, you know, changing your pillow to an orthopedic one, or just something that's more suited, you know, memory foam. There's so much out there that you can do. The second tip would be, because I know just how debilitating, you know, chronic insomnia can be and pain insomnia can be, is don't be afraid to reach out to your doctor if you're struggling. I know it can be a challenge to go to your doctor anyway with these invisible things, but you need to explain, you know, how much it's impacting you. There's been times on my own journey where I have been on medication for insomnia because I was like, at my wit's end, I was like, I need some sleep now. And that's how desperate you can feel when you're not getting any. So that would be my other tip. And the third one would be, if you're able to get your pain under control a lot more and your fatigue symptoms under control throughout the whole day, not just that end of the day point, then often I find with my clients that that is really, really helpful. So not actually just thinking of, you know, your wind down time at the end of the day. What are you doing the rest of the day that's impacting your pain towards the end of the day can be really, really helpful.
Yes, yeah. And you make a good point for people, even if you're not suffering fibromyalgia, actually. We do talk about the wind down routine, but you're absolutely right. It's very difficult to have a wind down routine if you're so wound up for the rest of the day. My goodness, you're so right. So on the positive side, but those are absolutely brilliant tips. We are keeping you for tips later as well. But on the positive side, what positive changes have you seen in the workplace, or maybe with the medical profession, or maybe with friends and family understanding fibromyalgia a bit more?
I think the workplace is actually something that's not spoken about enough because it's so challenging for people, and I often hear more negative experiences than positive ones. And I think, again, this comes to the misunderstanding from other people about chronic pain and the invisibility of the symptoms as well. And the workplace I just find can be really, really challenging for that, and often asking for a referral to occupational health is the best way to go, depending on the policy within your own workplace. But it's so important so that you can get the adjustments that you need, that's going to make your life that little bit easier. Anything that's going to make your day flow a little bit better and reduce the burden of your symptoms throughout your working day. And that's going to make you a better employee as well. It's going to make you more productive. It's going to make you want to be at work a lot more and increase your energy levels as well, which is going to benefit the whole of the workplace. So,
amazing. Well, we're going to head over to Business Boost, but we're going to keep Amy with us, and we'll come back to you just after this. In today's Business Boost, I wanted to talk a little bit about disclosing a diagnosis to our employers, because exactly as our guest has been saying, the workplace is a place where you can have a great experience. You can be praised, you can learn new skills, it can be really, really positive. But if you are struggling, that can be very difficult. So, some things just to be aware of. It is always up to you whether you disclose a diagnosis or not. However, one thing I would suggest is, if you can then be protected by the Disability Act or the Equality Act, and you want your employer to make reasonable adjustments, that can be quite helpful. That disclosure puts you in a much stronger position, but it is always up to you as to what you want to say. When it comes to reasonable adjustments, this comes from Mind. And they say, well, what is reasonable? And this is what Mind says. If the adjustment brings a solution that helps with whatever is disadvantaging you at that time, we have to consider how practical it is for the employer to make the adjustment, and also the employer's size and resources available. And also, if there's any other financial assistance or resources that need to be available to make that change. So it's a little bit on the woolly side. However, reasonable is the word to really focus on. And if you know what it is you need and you can make those suggestions, that's a really good start. However, I come back to how you choose to manage your diagnosis is always up to you. But I would say perhaps if you reach out, you then have the advantage that you cannot be discriminated against. Oh, Amy, you have been so enlightening to speak to.
Oh, thank you.
And you raise a very balanced view of the reality of living with chronic pain, reality of living with fibromyalgia, but also some of the things that we can do, some of the things that employers and the medical profession needs to do to just make it easier. I think for me, what you've really highlighted is life is tough anyway, and to then have something else that you're managing, especially when it's something which kind of creeps up on you, doesn't it? It doesn't. So I know we've kind of concluded the main interview, but do you mind telling me just when did you first kind of, oh, there's something not right?
I was recovering from a really severe kidney infection at the time, and I just didn't ever really properly recover from it. So I know that fibromyalgia can have many causes, you know, trauma, chronic stress, if you get an infection that you just didn't recover from, and other sort of traumatic experiences as well. You can have a car crash and then your life's just not quite the same again.
Yes.
So, yeah, just I realised when I just wasn't feeling quite well, that's when I just knew that, oh, I'm not... The gym was a big thing for me because I've always been quite active, and I was a personal trainer before I got chronic pain, and I just didn't feel like I was recovering very well from my sessions, and I was feeling a bit like I was coming down with the flu all the time.
Yeah.
And I know that you're quite tired when you've exerted yourself, but this was different, like, you know, struggling to function kind of symptoms. So yeah, that's when I realised that, you know, something's just not quite right here. Just a general feeling of feeling unwell.
I think that is something just we need to all keep in mind, because if we're not recovering, there's a difference between the remnant of a cold and just not feeling quite well.
Yeah.
I think that's so important. And so relating to that, I know we talked about compassion, and compassion is something we could all do with self-compassion in particular. But I'm going to leave it to our guest to give us her top tips for getting a little bit more compassion in our lives.
So I think actually when we speak about compassion with a chronic illness, it can be really hard to do. It's really, really hard, and possibly one of the hardest things to do when you don't feel like your body is quite yours anymore, or, you know, you feel like you've lost a lot of your identity. And I think if compassion is something that you're struggling to get to right now, actually just validating yourself a lot can be really, really helpful. So, you know, you're not going to go around saying, I love my body today, if you're feeling broken in your body, or you're feeling like you just miss the body that you used to be in. So I think validating yourself can be a really good place to start. And then working towards self-compassion can be that little bit easier when you have got that, you know, more positive and uplifting things that you're saying to yourself. And another thing is to become aware of the things that you are telling yourself. So many things crop up when you have an energy limiting condition. So things like, I'm not doing enough, or I'm failing. Loads of different things, you know, people give up careers, people give up their lives from having conditions like these, and it's so impactful, you know. And another thing to be aware of, something that I've been doing a lot of, is like inner child healing. It's been so good on my own chronic illness journey, and I've got a picture on my phone of me as a child. This brings me to tears actually a little bit. Sorry, I don't mean to cry, but, you know, it's so impactful. But when you look at that picture and ask yourself, what would I say to her? You know, the things that you say to yourself are so much more likely to change, and that's a really, really good practice to do, you know, particularly when you're struggling on your own chronic illness journey. Because you wouldn't say, you know, awful things. When you're looking at this little picture of yourself and you're thinking, oh, I wouldn't actually say any of this to her, that can be really, really healing. So
that's beautiful. Oh my goodness. That is something that we can all think about doing this week. And if you have done it, please pop it in the comments. We'd love to hear from you. Amy, thank you so much. You've just been such a source of knowledge today.
Thank you so much for having me.
It's such a pleasure. Please come back on the show again.
Thank you.
And to our viewers out there, please have a healthy week.